All right. Good afternoon, good morning, good evening, everyone, from wherever you're joining us from. I would want to welcome all of us to our webinar today. My name is Beatrice Deuri. I work for CBM as an advocacy manager. My CBM colleagues and I are thrilled to host this webinar on the role of civil society organizations in eliminating NTDs. We have brought together a diversity of voices, views, and expertise to this topic, and we hope that you will find this next hour enriching and insightful. We have a keynote statement from an NTD leader and a champion from Nigeria. We have video messages from youth-led and local civil society organizations, a live panel discussion with leaders from South Sudan, DRC, Democratic Republic of Congo, India, and also from Geneva. We have a session to engage you, the participants, in a question and answer session in this conversation. Before we kick off this webinar, I would like to walk you through some housekeeping rules. Please be aware that this event is being recorded for the purposes of sharing widely, even beyond the webinar today. For questions and comments, please use the question and answer function at the bottom of your screen. Please indicate the panelist that you would like to answer your question. Kindly note that French translation is available. Please feel free to switch to the French channel at the bottom of your Zoom screen. You're also welcome to input your questions or comments in French at the question and answer function at the bottom of your screen. Finally, thank you for sharing your comments and questions in a respectful way that recognizes that diversity of voices represented here today. To kick off the webinar, I welcome my colleague Ope to take us through a nice breaking session just to get to know where we are coming from. Welcome, Ope.
Hi, thank you very much, Beatrice. Hi, everyone. It's a pleasure to be here and really glad to be here with everyone. To kick things off, we would like to know which countries you're joining us from. And to do that, we would ask that you either scan the code that you now see on the screen or simply click on the link that would now be available on the chat section. There you would then come to a page to be able to answer this question. Thank you very much. I can see that we have kicked things off already. Fantastic. And we can already see a few countries already displayed on the screens. Please let's keep them coming in. Fantastic. You can see from the UK, UK is getting big. From the US, Germany, amazing. We have a very diverse audience today. This is fantastic. Germany, UK, US, a lot of Kenyan, a lot of countries are coming in as well. Fantastic. Let's keep them coming in. It would be nice to just get a feel of how many geographical zones and areas in which our attendees are joining us from today. Oh, lovely. Thank you very much. It seems like Germany and the UK is taking the lead now. Fantastic. Oh, lovely. Can we keep them coming in, please? We have also the DRC, Senegal, Paris. I think that's France. Spain as well. Lovely. From Atlanta, Georgia, that's in the US. Nigeria is beginning to grow bigger. This is fantastic. Thank you very much, really, for the wild varieties of countries that are participating today. And we're looking to have a very enriching conversation. We would leave the poll open so that everyone can, keep putting in their locations. And we say big thank you for taking part in this. Right now, we just hand over now to Girija Sankar, the head of the NTD program at CBM, to take us through the welcoming remarks. Girija?
Thank you. Thank you so much, Ope. If you wouldn't mind turning my camera on,
Yes.
be fantastic. And in the meanwhile, I'll let you know that there are a few people who've also put in their countries in the Q&A, and you'll find a huge diversity there.
Fantastic. Yeah.
I am going to, yeah, just if you can turn my video on,
Yeah.
it doesn't be working for me.
Oh no. Did you?
Well, in the meanwhile, as my video is warming up to be turned on, greetings everyone. My name is Girija Shankar, and I'm the head of NTD programs at CBM, Christian Blind Mission. And my video, there you go. Fantastic. Greetings everyone. Like I said, my name is Girija Shankar, and we're thrilled to host this webinar today on what we see as the urgent need of the hour in the fight against NTDs, neglected tropical diseases. The WHO NTD Roadmap 2030 calls for changing, and I quote, operating models and culture by increasing country ownership, clarifying the roles of organizations, institutions, and other stakeholders, their culture and perceptions, and aligning them to meet the 2030 targets, end quote. To a certain extent, it's been interpreted as what national, regional, and local governments need to do, which is advocate for increased domestic resources, prioritize NTDs in health plans, national health plans, etc. But what about the other organizations and institutions and stakeholders whose operating models and cultures must change? And more importantly, isn't country ownership not just about governmental ownership, but also civil society ownership of the fight to end NTDs? So today, on the eve of the 77th World Health Assembly, CBM would like to engage local civil society leaders, national governments, donors, and global influencers with this question. What can we, the NTD community at large, do to invite, embrace, uplift local actors, local civil society organizations, and community-based organizations? What do international NGOs such as CBM and donor governments and philanthropies need to do differently or more of or less of? So to kick off this conversation, I'm thrilled to introduce Dr. Francisca Olanijo, the Executive Director of Mitosat and a global leader and champion in NTDs, to share her experiences in leading her organization in NTD work. Franca is a medical parasitologist with a strong passion for public health, focusing on NTDs. Drawing on her passion for uplifting the dignity of human life, she's been able to steer Mitosat to become the biggest indigenous non-governmental organization on NTDs and a leading player in public health in Nigeria. Franca, welcome, and over to you.
Thank you very much, Girija. Can you enable my screen? Thank you. So thank you very much for inviting me to be part of this webinar today. I'll be speaking on role of civil society organization in the elimination of NTDs. My name, like mentioned earlier, is Francisca Olanijo. I'm the Executive Director of Mitosat. The next slide, please. And okay, so by way of definition, civil society is composed of those voluntary, community and social organizations and institutions that contribute to the functioning of our society, but they are not related or supported by the government. So in this bucket, you see the NGOs, faith-based organizations, you see community associations, you see trade unions, you see foundations. These are also societies. And outside, see the government is the these are not civil society organizations. Next slide, please. So one of these NGOs I'll be talking about today is Mitosat. And Mitosat happened to be the first national NGO that started supporting NTD work in Nigeria. And our vision really is to improve, preserve, and restore dignity of human life. And if, of course, you know that NTD does a lot of havoc to our dignity, and we are set to make sure that doesn't happen. So our mission is to partner really with government, communities, and the relevant stakeholders to improve quality of life. We work with governments, T.Y. Danjuma Foundation, South Atlantic Petroleum, and Site Savers, Mexican Donation Program, and Bill and Melinda Gates Foundation. And their funding to us is used to support activities in 6 states. In Nigeria, you can see them in green, Bauchi, Niger, Taraba, Ondo, Edo, and Lagos State. Next slide. So how did we start? You can see the executive director there, way back about 27 years back. She was probably about 6 years then, 6 years old. And this vision started to make sure that there's no river blindness in Taraba State. You can see the great philanthropist, T.Y. Danjuma, handing over the key of a Hilux to her in 1996. So that kind of started the dream of a national NGO moving straight full-fledged into NTD elimination. We thank the government of Nigeria because they gave us permission to work in just one LGA to learn from there, and we treated 22,000 people. But we are glad to share today, after 27 years, that more than 261 million cumulative treatments for NTDs has been achieved in the supported states by Mitosat. Of course, doing this, we strengthened the health system by training health workers and over 325,000 volunteers that we call community-directed distributors. And we have also supported hydrosis surgeries, over 2,200 and 3,000 surgeries for trachoma. Of course, also in Lagos State, we were able to conduct the very first effective mass drug administration and also treated LF in Lagos. As you know, Lagos is an urban city, but we were able to achieve effective movement. Next slide. So in this, I would like to take some time to share what was the challenge we faced. You know, all of this didn't come without challenge. We had acceptance challenge. First, how do you get into this space? You are young, you don't have a history. In 1996, 1997, thereabout, how do you get into this space as a national NGO and international NGO? It was really challenging. But how did we get through? We had people, of course, General Danjuma supported us, but beside that support, we had a mentor. And today we thank Mr. Jeff Watson. My first trip out of the country representing Mitosat, I went with Mr. Jeff Watson, the country director of CBN then. Actually today, Girija, I must remind you, this is the dream Mr. Jeff Watson had. CBN Mitosat mentorship. He shared this 25 years ago, and today it's happening. We are sharing that result. Mentorship is very important. CBN, Jeff, and the team in Nigeria gave us that support, and we were able to be at the table with international partners discussing how to engage local national NGOs. What about bureaucracy and complex hurdles that we had to comply with? The easiest way to get through a challenge is to face it. We adhered completely to the standards that was put in place, best practices, because we were not able to attend meetings to be with the international partners, national partners, and all those agreed standards were maintained. What about funding challenges? Because we were able to achieve results, showed value for money, and of course had an effective implementation, which was, checked by Federal Ministry of Health, WHO, then represented by APOC. We were able to achieve what was said and even go beyond it. It was easy for donors like the End Fund, Sightsavers, and more funders to come in. We delivered on the results expected. So that confidence was there, and it helped us to, gain that confidence to get more support from international donors. The next slide, please. Next slide. All right, so this is just to show you what we can do as a local partner. The slogan, leave no one behind, we implement it to the last. We leverage local expertise. Of course, it's arguably our great strength because we provide that unique insight and approaches that complement the effort of our international partners. You can see here people trekking through the rocks. If we need to enter the boat, we do that. If we need to cross with motorbikes, we do that. If we need to put our vehicle on the cross the river, we do that. And trek in 2021, our team trekked 6 hours to go and meet communities on Duncan Hill, just to make sure they are part of the World NTD Day celebration. 6 hours trek on foot. And you can see the flag of Nigeria, Mitosat, World NTD Day. And over the years since then, since 2021, we've had that celebration together. So we leave no one behind in our implementation because we are locals. We know the environment, we can navigate. Next, please. Next slide. Okay, away from Mitosat now. This picture was taken, the first picture up there was in White Sands, Dar es Salaam, shortly after Mitosat was accepted as an international NGDO. Here, this picture, I know a lot of you will recognize some people here, Sightsavers, IMAs, Helen Keller, the Cattle Center, all the partners. These are the first pioneer partners, the ONCO NGDO partners. They meet twice a year to be able to discuss, share best practices, and be able to plan together. Of course, that gave back to the bigger, bigger partnership now, the NNN. You can see it's a bigger family with CSOs from just not the disease-specific groups, but also from cross-cutting partners, WASH and the rest. You can see we meet also annually, once a year, to be able to discuss, agree on what to do, prioritize. But when we finish there, we don't stop, we come back home. We meet local actors. So these are things that CSOs can do. These are things at different levels. You interact at the national, at the international level, at the national level, and even go down to community-based organizations that you don't need so much to engage them. You don't need so much to make them part of what you're doing, but they will do much more for you if they are rightly engaged. Next slide, please. So basically, this is what we know that we do. We work closely, as implementing partners. We provide technical and financial support to countries. NTD Steering Committee. We do advocacy. We mobilize domestic resources and also the political will. We identify NTD issues that require operational research, and working with government, we're able to address them. We were at the NOEC last 2 weeks ago in Nigeria discussing about issues that are out of order. And we felt, operational research was important. And we as partners also are making suggestions on what to do. We also translate policies into practice, working with government and our supported states. Next, please. So that other slide was general. Now, civil society organizations, why do we need them? Especially nationals, especially community-based. Because they are effective change catalysts. They are vision-driven, they have their vision. They don't compete with government, but they complement the efforts of government. They mobilize their own resources. But what are they mobilizing the resources for? To support the government. They have technical expertise. Some of these CSOs are people from civil servants that have retired, but they still want to contribute. So they are in the communities, they are in the organizations as part of the system. So they are there for a long time, just like government is there. People live in those communities, they're part of those communities, so they can actually help sustain those things that has been achieved through the collaboration of all the partners. The next slide. Now, you have national NGOs. Why are they specific? They are nationals. They understand the terrain. I was showing you the other time. They are committed. They can relate with those diseases. They have families that are affected by NTDs. They see them, they live with them. This one is something that you need to hold on to. With proper planning and strategic engagement, they achieve more for lesser amounts. That's the truth. You need to engage them, but you can save by working with national NGOs. They remain part of country's capacity for sustainability. They are in their homes. They are not going anywhere. So community-based organizations live in the communities. Their religious groups, their cultural groups, their CDDs, their road transport workers, they can support the community in sustaining the efforts that has been put in place. As a round up, I want to give some recommendations. Next slide, please. Yes, I think Girija mentioned this earlier. We need to have this paradigm shift. Government, country ownership is not solely government ownership, but all other in-country stakeholders' ownership. And we need to make sure that we engage them alongside. If they are in those countries and government is there, they help government sustain the NTD efforts and the gains that has been achieved. We need to encourage the engagement of community-based organizations. CBM has given us that example. Every NGO at national, international level, we need to prioritize mentorship. Mentor national NGOs, mentor CSO, like the international NGOs, mentor national mentor community-based organizations. Let them be there supporting the work that we do. The stage we are in now with NTD elimination, we need to talk about sustainability. We need to talk about sustaining the gains that we have achieved. Last slide. I just want to say thank you to all our donors. And you can see that this is a generation of children that will not be locked in that chain of poverty due to NTD. Thank you very much for your attention.
Well, thank you so much, Franca, for that powerful message that lays the groundwork for the rest of the conversation today. If there's one key take-home message for me, it is that of mentorship. And you've talked about how in your 30-year history, you've been both a mentor to other civil society agents, and you've received active mentorship from perhaps larger organizations. So thank you so much for that. It's really was really energizing and inspiring to hear you speak. Now I will invite my colleague Ope back again to walk us through the next brief session. Thank you.
Thank you. Thank you very much. Good job. Thanks so much also, Franca, for the wonderful presentation. Now we want to show you a video. And this video, what it shows is it demonstrates really the amazing work, the leading work that community-led civil society organizations, including youth-led organizations, are doing on the ground to really foster country ownership in eliminating NTDs as a public health challenge. And this is the video that you would watch today.
I'm Huria Medi. And I am Hamad Rajput.
And we are the founders of
CAN 1.5.
With a vision that neglected tropical diseases are not an isolated issue, but they are interlinked with some of the most pressing challenges facing our world today. We are on a global mission to advocate for NTDs at the nexus of climate action.
With the active participation of youth from different parts of the world, and by cross-sector collaborations with diverse organizations, we are able to reach more than 700 people from different parts of the world, creating a significant impact in this short time span.
We have launched several projects, including Dialects of Change, where we advocated for NTDs in climate in more than 13 languages in Nigeria and Pakistan.
As NTDs disproportionately impact women, our She Can project empowered more than 100 women and educated them about NTDs.
Additionally, through local government and non-governmental collaborations, we have organized spray drives, capacity building workshops, seminars, and campaigns. Together, we can.
Together, we can.
Together, we can.
Together, we can.
Hi, my name is Afolabi Oluwasegun, and I'm a volunteer youth advocate at FOTIPACT. Now, over the months, FOTIPACT has had 4 priority areas, which is wash, water, sanitation, and hygiene. We've had climate change, very, very important. We've had nutrition, and finally, mental health. Now, as a youth-led organization, we'll be able to carry out advocacy at different local governments within the country, sharing the news about NTDs and how to combat the diseases through the 4 priority areas mentioned earlier. At the World NTD Day on January 13th, 2024, we were able to mobilize 700 plus youths to join our roadwork in Kwara State and also support the State Ministry of Health with advocacy material. We carried out sensitization and awareness program on NTDs across 5 states in the country. Going to the core of the community and bringing information to the doorstep of individuals is our drive. And our full impact, what this means to us is leaving no one behind in the fight against NTDs.
Thanks to the remarkable action of civil society organizations, a growing interest in neglected tropical diseases is developing. Indeed, 15 CSOs from Benin, Burkina Faso, the Republic of Guinea, Senegal, and Niger have joined forces in a regional coalition to combat NTDs. In Guinea and Niger, the national multi-sector coalitions against NTDs have been officially recognized by ministerial decree. The prioritization of NTDs is also forming in Guinea and Senegal, with the signing of a ministerial decree integrating NTDs data into the quarterly review of malaria data. In addition, support from ALMA has enabled the development of 4 NTD scorecards for control and elimination programs. In addition, to strengthen commitment and budget allocation at the national level, civil society organizations in Niger and Senegal mobilized a total of 37 parliamentarians in favor of sustainable funding for NTDs. At local level, a dozen local authorities in Niger, Benin, and Senegal have included activities to combat NTDs in their communal development plans with a budget exceeding 30 million CFA.
Évidemment, ils peuvent défendre le besoin des politiques et des ressources financières à travers une influence dans la mobilisation des ressources locales, mais aussi de mieux impliquer l'opposant et contribuer à la surveillance publique de l'élaboration des politiques.
We do hope you enjoyed the video. Now I would like to hand you over to Julia Enenigela, a senior NTD program manager at CBN. Julia?
Thank you very much, Ope. Could you kindly enable my video? Thank you. Hello, everyone. Thank you, Ope. I'd like to kick off the panel with a brief. Sorry about that. Okay, thank you. I'd like to kick off the panel with a brief round of introductions of our esteemed panelists. May I please request our panelists to turn on their cameras, please. Okay, I would like to start with Mr. Yak Bo. He's the Director of Preventive Chemotherapy NTD's Ministry of Health, South Sudan.
Oh,
Mr. Yak, could you turn your camera on, please?
yes. Yeah, thank you very much. I hope you have seen me on other side, because my camera have challenge here is say you cannot, and you unless you have date. So are you seeing me on other side?
Ope, could you confirm that?
Can you confirm whether you are seeing me on other side?
Yes, I can see you now. Thank you.
Thank you very much.
So,
my name is Yak. Yeah, welcome.
So I'll just provide a brief introduction. So Mr. Yak is a public health practitioner who has served for about 18 years as a civil servant at both subnational and national levels with the Ministry of Health in South Sudan, focusing on NTD's program delivery. He currently leads and coordinates the Preventive Chemotherapy NTD's program, which includes onchocerciasis, lymphatic filariasis, schistosomiasis, soil-transmitted helminthiasis, and trachoma. He also provides strategic direction for both internal and external stakeholders. Yak spearheads advocacy for domestic resource mobilization to increase government buy-in for sustainable NTD program implementation in South Sudan. Moving on, permit me to present Mr. Aman Ali. He's the Executive Director for National Center for Promotion of Employment for Disabled People in India. He's a prominent figure in India's disability rights and in the public health sector. He has over 2 decades of experience in advocacy training and policy making. He currently serves as the Executive Director of National Center for Promotion of Employment for Disabled People. Aman's background demonstrates a strong commitment to public health. His leadership roles with organizations such as the Election Commission of India, National Human Rights Commission, and the Ministry of Social Justice and Empowerment addresses social issues that impact public health. His participation in UNESCO's editorial board for the State of Education report for India in 2029, Children with Disabilities, further highlights his concern for inclusive public health initiatives. Our third panelist is Mr. Vincent Kamwasha. He's a senior M&E officer for United Front Against Blindness and Other NTDs in DRC. Mr. Vincent has been a doctor at the University of Lumumbashi since 2023. He has worked at several operational and intermediate levels of the government's health system in Katanga province. He served as a monitoring and evaluation consultant for Council Sante Sofesho, acting as a monitoring and evaluation expert for the External Evaluation Agency of the Health Sector Support Project from 2013 to 2014. From June 2014 to March 2016, Vincent worked as an epidemiological surveillance officer and as a ZS supports issues analyst in 2016. Passionate about the fight against neglected tropical diseases, he was recruited by the United Front Against River Blindness in DRC as a technical assistant in charge of NTD's CTP from July 2016 to December 2022, and subsequently as a senior program officer from 2022 until now. So he currently works as a senior program of M&E officer. So moving on to our final and fourth panelist is Mr. Gavin Wade, lead community engagement at the Global Fund. Gavin Wade is a senior technical advisor for community engagement at the Global Fund to fight AIDS, tuberculosis, and malaria. Based on his experience in delivering programs led by and for marginalized and criminalized population, Gavin is a passionate advocate of communities playing their full role in the community-led health responses and in the co-creation of sustainable health systems that advance human rights, gender equality, and health equity. In his role at the Global Fund, Gavin provides strategic and technical leadership to improve meaningful and sustainable engagement and leadership of communities in governance, decision-making, service delivery, and oversight. Gavin was born in Peru and grew up in the UK, but his home and heart are both in South Africa. All right, thank you all for taking time to join us today. I have 3 questions I'd like to ask each of you. At the end of the guided panel discussions, we will open the floor for a brief Q&A with our audience. I would like to urge the participants to feel free to type in your questions and answers using the Q&A function at the bottom of our Zoom screen. Let me start with you, Yak Yak. So what specific contributions do local CSOs in South Sudan make towards NTD elimination efforts?
Yeah, thank you very much. Yeah, thank you very much, MC. Ladies and gentlemen, of course, as said, my name is Yak Yakbol. I'm National Coordinator for PC NTD in the Ministry of Health, Republic of South Sudan. It is really a great pleasure for me to participate in this whenever. And I would like to thank the Christian Blind Mission for inviting me to participate in this very great discussion to share my thought with the all participants. In fact, the civil society in South Sudan have so many multiple contributions. And this contribution is not necessary for health. There are so many civil society that are established and operating in South Sudan for long. Most of them are very active in other areas like protection, human rights, and promotion of awareness, especially in HIV, other sector in health like HIV. When you come to the contribution of civil society, specifically for neglected tropical diseases, there are few contributions. South Sudan, of course, everybody knows that it's been in the conflict for long. I think 90s, 80s, 90s. Until recently, there were other conflicts. Those conflicts affecting the operation of civil society in the country. However, despite of all those challenges that facing civil society, some of them managed to establish themselves actively within the community and within the society. There are few contributions when you come to neglected tropical diseases. Those contributions are focused mostly on advocacy to increase awareness within the communities in different locations. We have a diocese of Wow, which is operating in one of the states called Western Bahr el Ghazal. The diocese of Wow is creating awareness of neglected tropical diseases, focused mostly to identify it and screen the afflicted cases within the community in one of the county in Western Bahr el Ghazal. Those screening are going on for Newton syndrome and onchocerciasis associated epilepsy cases. And the same organization, which is a civil society, is also providing the treatment to the patient that has been confirmed to be epileptic that is related to Newton syndrome in that area. Another organization that is supporting onchocerciasis and lymphatic filariasis is ON8. This is a local civil organization that is operating mostly in central Equatoria. Where we sit, they say that the capital is located, and in Western Equatoria state. This organization is supporting the Mass Drug Administration and as well as MMDP, LF MMDP in a few counties that has been identified in Western Equatoria and part of Central Equatoria. He is involved actively in increasing awareness and advocacy and engage local leaders and the community to raise awareness on neglected tropical diseases that are endemic in Central Equatoria and Western Equatoria state through the Mass Drug Administration. We have another organization, the civil society organization, which is operating also in South Sudan and is also focusing mostly on advocacy within the community. This civil society is called, is a missionary civil society which is based in Juba, where I base. It's mostly focused on increased awareness on the, mostly increased awareness on the onchocerciasis within the community in Juba County. And this civil society has been in advocacy process for so long. In fact, is one of the active civil society in the capital city that is extended even engaging the local communities on health education and active participation on the implementation during the MDA. Those are the few civil society that are currently involved in the program. In fact, most of civil society are mostly focused where they get funding like human rights, child protections, and other humanitarian organizations that have been supported by UN agencies. This is where they get funding and this is where they focus. Other they are focused on promotion of democracy and political activity across the country. This is where they get funding. But for neglected tropical diseases, most of civil society in the country, and there are many, they are not well informed and they don't have much information about the burden of neglected tropical diseases in the country. And that's why you see only few has been involved in the supporting neglected tropical diseases, focus mostly on advocacy, increase awareness within the community. I think this is what I can just say on this. Thank you very much.
Thank you very much, Yak, for your very valuable insights from the government perspective. My next questions were going to be if there are local CSOs and if they are growing in number and if there is awareness among local CSOs about NTDs. But I think in responding to the first question, you already responded to those questions. So thank you very much. So allow me to come to you, Mr. Arman Ali. How do CSOs implement the efforts of government in tackling NTDs or in other relevant humanitarian work topics such as disability inclusion? And I mean, in responding to that, we'll be very happy if you could share a success story where you have successfully contributed to NTDs elimination efforts or any relevant topic in your community. Thank you.
Thank you, Juliana. I would like to first acknowledge the fact that Mr. Yak Bol himself, being from the Ministry of Health, being present of this meeting says a lot about the commitment that he has. And I'll echo his inputs that he's talked about. There's a need to create awareness within the community. We are a firm believer that people who are self-advocate, people who are self-advocate, who have the conditions of NTT, can speak about their challenges and create a strong network of self-advocates to advocate about the needs and challenges of people who are affected with NTT is crucial. And I think this cannot be done in isolation. There's a need to have a strong partnership to implement the schemes or campaign or programs of government and Ministry of Health and so on. Largely not limited to only organizations who are working with people affected by NTT, but beyond that, there's a need to play a larger role to sensitize media, because there's a lot of stigma around these conditions that people may have, and that results in not coming forward and taking advantage of programs that are being introduced by the governments. With our experience in India, we have had a large presence of people affected by NTT and leprosy, and how they have self-advocacy and coming together as a group, as a pressure group, and engaging with the sector, not limited themselves to only one particular ministry, but across from social justice to Ministry of Health, and trying to use multiple forums to put more pressure on getting the kind of support that is needed to eradicate and get support for people having these conditions. It includes political interventions with getting the highest office in the country to acknowledge the issue. Also trying to mobilize parliamentarians, using judiciary, putting up public interest litigations. So I think there's a multiple approach that is required to be done, and we have had this experience of people who have come forward and as a group, as a core group, and moved to various kind of issues from time to time. If you look at India, it's a large country, and it has a diverse population and people from all walks of life, and largely people who are affected with NTT is also come from a marginalized poverty group, which makes it a little difficult for you to voice your concerns, but that is where a large network of multi-sectoral approach is required to do, and that is where we have seen some success in India. Back to you, Juliana.
Thank you very much. And I mean, it's quite interesting, and that you guys are doing a lot of things based on your feedback. But I would also like you to speak about how easy or difficult it is to get funding and how you're able to access global funding.
I think getting funding for doing advocacy work is very difficult. Doing advocacy and awareness, it's always remains a challenge. But international funding, there are opportunities of getting international funding, but it is also a challenge to organize a group to get the kind of requisite permissions that you want to procure foreign funding in India. It is becoming difficult by the day. So funding within the country to look at entity from a health perspective, there are opportunities to get corporate social responsibility fund, but international funding, there are opportunities also to get, but it is becoming difficult by the day. So again, go back to this point, which I reiterate, that there's a need to create a larger awareness and by the self-advocates, people who are affected by entity and so on, to kind of reach out to people and governments. And once you can break a partnership between government and the groups of people who are affected by entity, a multiple channel of funding also opens up, and it kind of gives you the kind of credibility that you want to secure more funding to do a large network work or on a mission mode. So I think there's important that we have partnership between self-advocates, other civil society organizations, corporates, and the government, and particularly the Ministry of Health or Department of Health and Social Justice and Empowerment.
Thank you very much, Mr. Ali. I mean, it's interesting that the funding landscape is something that is becoming more difficult by the year. Looking at the landscape for CSO engagement, could you provide more insight on that? Has it changed over the years, and how so? Has the change been positive or negative?
So, Juliana, my work is very focused on advocacy and a rights-based advocacy. There's always been very challenging to get the kind of resources that you want. And disability is, if the beneficiary model for funding is a challenge, that when a funder looks at people with disability or people who are affected by NDT and as beneficiaries, and you need numbers, and if you look at a number based or other based of funding for the group, it becomes a challenging. And advocacy work requires years of efforts to put around creating the kind of pressure that you want to do, and it takes time to change, and this change is to do with policies. It's the change is to do with, like, for example, if you want to influence health insurance policies for people who are affected by entity, it just cannot happen in a year or two. It's a time-taking effort. It cannot happen only with a kind of pressure or interaction between the civil society organization and the health insurance companies or the government to come up with this kind of a thing. So there are multiple intersectionalities that need to be considered, and I think it is time that we relook at our efforts. How do we come together as a group and do it a little more organized way, understand our needs, the long term and the short term, and we must cooperate where we can and confront where we must.
Thank you, Mr. Ali, for the very valuable insights. Moving on to Vincent, please help us understand your experience in DRC. How do CSOs complement the efforts of government in tackling NTDs or any other relevant health and humanitarian topics such as disability inclusion? And I would also urge you to share a success story where applicable. Thank you. Over to you.
Thank you, Juliana, and thank you to CBM for the invitation. And I am also very happy and motivated by the team and commitment of NGOs and civil society organizations in the fight against neglected tropical diseases. Indeed, we are committed to this fight. I work with UFA, which is an international NGO licensed in the United States that is also headed by Dr. Daniel Shungu. Since 2005, this organization has been operating in the Democratic Republic of Congo, and since 2006, the organization has been working with the Ministry of Health, and these activities have gradually expanded. We started in Maniema, of course, with the support of our partners. We started with the support of site savers, and of course, with the contribution of members, and with the successes we had in implementation, starting in Maniema. The activities expanded due to the credibility, accountability, and good management we had with the partners. We even expanded the field of actions, and to date, the organization is present across the country in 26 provinces, covered by the DRC precisely. But we are only in the DRC. We are not in other countries, and we cover about 10 provinces, supporting the fight against neglected tropical diseases. And regarding your question, you see, the government's support in the fight, this is an issue because we may need to do more advocacy so that the government's contribution to the fight is substantial. But there is a difficulty with that, and the government and us, as members of the NGO coalition in the DRC, together with CBM, we work in collaboration. And I really believe it could be better, and it would be better to raise awareness among the government so that their contribution is substantial to achieve the objectives by 2030. And also to support our accompaniment and our commitment to support the Ministry of Health. We also work with communities. We assist the communities to put strategies in place. But when we started with this system we adopted, we supported communities more in implementation of activities and the local community development. Of course, our support is to work with the village chief and other community members so that this community adheres to the strategy of mass drug distribution. And there were, of course, kits that were given privately and also placed in villages to the head of the villages and so on. But these approaches did not respond favorably because there were reports of abandonment, unfortunately, and this led us to seek another approach so that we could reach all communities. In implementation, as you know, we indeed face obstacles. We face obstacles till this day in the implementation of reaching neglected people. But it is a work that needs to be done. And also, in response to that, we must also respond to the GE approach. And the GE approach is gender equity to social inclusion in all these elements within the issues we are dealing with, so that we can support the Ministry of Health to achieve the 2030 goal. Thank you.
Thank you very much for the valuable insight. I have a few follow-up questions on how difficult or easy to get funding and how you're able to access global funding. And also a question around the landscape for CSO engagement, if it has changed over time, and how so, has it been positive or negative? Over to you, Vincent.
Effectivement, on a eu à voir.
Yeah, we had difficulties to have funding. With the COVID, the pandemic, it was more difficult. We had less funding and less coordination. It wasn't possible to set up some activities. But with the credibility that we have, as I said, we began with 6 of us. Now we well, with this funding, we have funding to help to accompany the Ministry of Health. It's our advocacy work that we do with these donors that help us to have the fundings. And there are also contributions from it's a problematic because we use communitary distributors. It's older philosophy, and they were voluntary with distributor and
pour te mettre à la disposition de bénévolat. Et ça aussi, un
the sound
handicap. Les
was not very good.
organisations
We had a problem, and they support us, but we must dynamize their action to have more.
Thank you very much. I'd like to call on my colleague Michelle to do a quick summary of Mr. Vincent's response for the interest of colleagues who are not able to.
Okay, so I hope that the translation was done directly when he was talking.
Okay.
People participate
in that case, I'll move on to the next panelist.
Is it Julia? Is it okay?
Yeah, for me, I heard it clearly, but I don't know about other colleagues or other participants. Yeah. So I would assume other participants also heard clearly. All right. Thank you very much, Mr. Vincent. Thank you again. So coming to you, Gavin, the HIV sector has been a pace setter in terms of engagement in local CSOs. Would you provide an overview of the Global Fund's approach to engaging local CSOs in HIV and AIDS prevention, treatment, and care programs? Over to you.
Thanks, Juliana. I'm grateful to you and to Christian Blind Mission and colleagues on this call. It's fascinating for us to learn about the role of CSOs in eliminating NTDs. For the Global Fund, since our creation, we've championed community engagement both as a principle and as a core element of our implementation model. As Francesca highlighted in her presentation, there's a wide spectrum of non-state actors, including INGOs, NGOs, FBOs, academia, private sector, and technical partners. But when we at the Global Fund speak about communities, we have a specific focus on people and communities that are disproportionately impacted by the 3 diseases and who often have least access to services. What's quite interesting is that in many cases, there's a significant overlap between those most impacted by NTDs and those most impacted by HIV, TB, and malaria. It's often the most excluded, the marginalized, the poorest, and criminalized populations. So our approach really builds on, similar to Armin's comments, on the importance of lived experience and links to principles that we have. We have the Denver Principles that articulates the importance of self-empowerment, and the JIPA principle that calls for active and meaningful participation of people living with HIV, that we take more broadly as people living with diseases, in the inception, development, implementation, monitoring, and evaluation of policies, decision-making, and also of programs themselves. However, our approach is driven not just by principles, because there's also a significant body of evidence and technical guidance on the positive impact of ensuring community leadership engagement in health responses, from reducing health inequities to improving the availability, accessibility, acceptability, affordability, and quality of services, and thereby improving health outcomes. And finally, we also have considerable experience from epidemics and pandemics, from HIV to Ebola to Mpox and COVID, that show us that communities bring to the table critical and unique perspectives and expertise that are essential to successful responses. So we engage communities not just as beneficiaries, but as full and equal partners with relevant and critical technical expertise that are critical to us achieving our mission. And at country level, we have mechanisms called country coordinating mechanisms, which are multi-stakeholder committees that are responsible for submitting applications to the Global Fund and overseeing grants on behalf of countries. These country coordinating committees, or CCMs, include representatives from all sectors involved in the responses to the 3 diseases. And for example, in DRC, 46% of CCM representatives are non-state actors. In South Sudan, it's 56%, and in India, 54%. And out of these non-state actors, 24% in DRC are from key affected populations, 18% in South Sudan, and in India, 50%. So it's really important that we are able to work with that diversity of non-state actors, but critically having those most affected by the diseases actually central to decision-making and oversight of the decisions and also the actual program implementation. Let me pause there.
Thank you very much for that insightful response. So coming back to you, Yak, what opportunities exist for further collaboration between the Ministry of Health and local CSOs to strengthen NTD's elimination at the community level? Over to you, Yak, and I think you're muted. If you're speaking, I see you're speaking, but you're muted. We cannot hear you.
All right. Okay, thank you very much. There are many opportunities within the community, within the country, to engage civil society and the community-based organization, including faith-based organization, to participate, to join a fight against neglected tropical diseases. But those opportunities, first of all, what in our mind, because few of them have been engaged at the movement, and there are so many of them that are outside engagement. And we know very well that many community-based organizations are operating within the community. And this community-based organization, those are opportunities because we have all the structures of the NTD program from national up to the community-based up to grassroots. Through those structures of neglected tropical diseases, we can simply be able to engage the civil society organization or community-based organization that are existing within different communities. So through our network of the NTDs is a strong opportunity to engage other community organizations. The other opportunity that exists is through, there is a network for civil society that it can be approached directly through the Directorate of Neglected Tropical Diseases. And through that body, we'll be able to reach almost all of the civil society that are working across the country. So there is a really potential opportunity that is available in our hand. Another opportunity is through also there are community-based health structures that are operating within the community, and they have full structures at the community level. Through those, because they are a part of the health system in the country, through them, we can be able to reach those civil society that are operating within the community at level of grassroots.
Thank you very much, Yak.
Thank you.
Thank you very much for that feedback. So in 60 seconds, Amran, I would like you to just quickly give us a brief of what are some unique opportunities and challenges CSOs face in their involvement with their work, and what innovative approach that you have adopted to address or overcome these challenges. Thank you.
I think the biggest challenge is coming together for a common cause. You know, when you make people who are having lived experience of, you know, any disability or entity or so on, to make the focus point and of decision making. And to overcome this, I think there is a need to create a you know, large scale awareness mission mode campaign to mainstream the issues of people who are affected by entity or any other disability that may be you know, can be overlooked at. And all this, I think we cannot look at it from only civil society point of view. You know, we must engage with all the stakeholders. There is a need to come together, and I think there's a strong political will is required to find solutions for all these issues. This cannot only be done by people who are affected by entity or people with lived experience and civil society and funders. So there has to be a political will, and you just need to engage with the right kind of people. Back to you, Juliana.
Thank you very much, Ali. I would encourage all participants to please feel free to use the Q&A option as we are about to move on to the Q&A. But just one final question to you, Gavin. One final question to you, Gavin. What lessons has Global Fund learned from its experience in engaging local CSOs in the fight against HIV/AIDS, and how are these lessons influenced? How have these lessons influenced its future strategies and approaches? Just key highlights, 60 seconds. Thank you.
Okay. Hi, sorry about that. I was having a problem unmuting. So, I mean, I think that there are challenges in really, I mean, the long-term sustainability of ensuring that we have community responses is really to ensure that communities are recognized and valued as legitimate actors who bring not just lived experience, but technical expertise and skills as well. And I think it's going back, as Francesca was saying at the beginning, to look at all the resources within a particular context or country, and what is the right mix in ensuring that we're able to leverage all those resources from communities and civil society through private sector and government, and how are we able to best respond and navigate issues around power dynamics, issues around trying to have an effective allocative efficiency of resources to deliver best results. And that isn't always easy. I also think some of these issues around disease-focused approaches, we really need to be thinking much more holistically around people's health, and that there are some sort of processes that are helping to guide us around this, but critical in all this is going to be ensuring having a multi-stakeholder approach that includes those most affected, so that we're really being able to design investments that are based on actual and changing realities of people's lives.
Thank you very much, Gavin. I wish we could go on and on. This is very rich content and rich discussion. But as we all know, whatever good things has a beginning has an end. So I would like to wrap up this panel discussion, and I would like to welcome my colleague to take a lead as he leads us through the Q&A. But I'd like to thank you all for its wonderful deliberation, and I would hand you over now to Thilo. Thank you.
Thanks, Juliana. Greetings from CBM Berlin office in the German capital. And yeah, I very much agree. It's great to listen to you. I could listen for a lot longer there. Thanks for all that very valuable and rich contributions so far, and great insights. Yeah, unfortunately, we run already over time, and we've only foreseen 10 minutes for that Q&A, as that's the webinar format. There are great comments and questions. Unfortunately, we will not be able to answer them all right now. 10 minutes by far are not enough for that, but we can and should definitely continue these discussions at the sidelines of World Health Assembly next week in Geneva, at the coming NNN meeting in Kuala Lumpur, where we should further discuss the focus of today's webinar. So at least let's have a brief look into the question and answers, and then I would ask our four panelists perhaps to kind of in an elevator pitch format answer this question of Wendy Harrison on key things NGOs in non-endemic countries should do or not do to support country ownership understood in a way, as Franca stated, not solely government ownership. There's a question also addressed to CBM. We will answer that afterwards. I would say that was addressed in French. There's a question addressed to you, Gavin, which I also think is a quite interesting point, as you mentioned yourself, the overlap of NTDs and AIDS, TB, and malaria, in how far one could further integrate that also in the Global Fund. Perhaps you want to briefly comment on that. And there are lots of other great questions. Thanks for that. We will take them with us. But I would like to start perhaps with Arman, from your perspective in India, the question on NGOs in non-endemic countries. What would you ask them how to better support what they should do or not should do country ownership? Please go ahead.
Michelle, I'll reiterate my point. I think there is a need to coming together and advocate with the government in a very strong way. The voices of people with lived experience of entity and so on must be made, very obvious and clear and loud, and not under be any kind of a pressure or a stigma. So I think there is a huge lack of awareness within the groups itself. The self-advocacy is still not there. A lot of the young people who can be the voice should come forward and engage themselves and be vocal about the needs and organize all stakeholders together, so that there is larger synergies into the kind of solution that we're looking for.
Yeah, great. Thank you very much. And indeed, I think there's even also on a global level now more and more discussions on more focus on community-based approaches, but still the participatory approaches, I think they often on global levels, on interregional levels, still lack really a good implementation. Gavin, what are your thoughts on that, and perhaps also on the other question addressed to you?
I mean, these are big questions, and I would definitely welcome a sort of an ongoing conversation, because I do think it involves action both at the country level, but also at the global level in how we can educate donors and funding streams to respond more holistically. I do think that this advocacy for non-endemic NTD countries, you know, we're going to have to start thinking about which are NTD countries with climate change, right? And I think that this is, again, an issue that across the health sector, we need to engage in climate change, and climate change needs to take into account health considerations. Climate change is having real impact on health systems. It's also having impact on, if we think about mosquitoes, mosquito life cycles are changing, as well as geographic areas where mosquitoes and, for instance, dengue fever would be. But also changes in temperatures is also going to be impacting where NTDs are going to be relevant. So I think in terms of the direct question about including leprosy and other NTDs, I think that there's a willingness to start to think about, you know, in what ways are we supporting systems for health? And I say systems for health purposefully, because yes, health systems, but also the community systems are absolutely a critical part of this. And how do we start to think at least about referral pathways and then integration? I think integration is quite easy to say, it's quite difficult to realize. And we have a number of barriers, not just in terms of funding streams, but also how health is organized at country level. And I think that, you know, we can want to do integration, but quite often when we have integrated programs, the first thing that we see happen is they get divided up again by actors in country. And that's by no means a criticism, it's just a reality of how we're structuring things. And it isn't acceptable, particularly when we're talking about those most affected by NTDs, or from my perspective, HIV, TB, and malaria, because if people reach a service and they're vulnerable, they should receive comprehensive services rather than saying, sorry, you're an NTD, we can't support you, or someone arriving with TB to an NTD service and can't be serviced. We need to have smarter delivery platforms.
Wonderful, thank you so much. And yeah, indeed, let's work together in making CSO become even more effective change catalysts. So I think we're on the same page with all that. Thanks, and excuse me that we stop with the question and answers at that point for the sake of time. But we will definitely continue these discussions, as I said, next week, and also then in the upcoming NNN meeting again. And exactly for the closing remarks, I would like to hand over to Dr. Jemish, who's the current chair of the NNN network and head of programs and learning at the leprosy mission in Nepal. Jemish, floor is yours.
Thank you. Thank you. Hi, everyone. Thank you very much for being a part of this very insightful and engaging webinar. And on behalf of the network, I would like to extend special thanks to CBM for organizing this session. And of course, to all speakers, panelists, for the facilitators, everybody. It was a very good opportunity for a very engaging discussion. This session has also highlighted some key challenges, maybe given us some solutions, ideas of some solutions, and of course emphasized the critical role that civil society organizations play in this fight against NTDs, one that the NTDs NGO network firmly believes in, and one that the network is attempting to take forward through its regional networks and conferences. The NNN now is a member of over 100 members across the globe, and we are looking to increase this membership and in a more meaningful way. In order to do that, the network is currently planning to undertake a strategic review, one of the aims of which is to better understand how we as a network can support the engagement of implementing organizations, civil society organizations, influential donors, and the government stakeholders. And now we as a network can facilitate this collaboration better to move ahead together.
So every year, the NNN conference also prioritizes various endemic regions and to create the environment for an interactive discussion on possible collaboration and participation of local members in each region. We've begun initiating dialogues on establishing networks within each endemic region. The discussions today have definitely reiterated the importance of this kind of collaboration and a sustained effort in our mission to eliminate entities. Of course, you're all welcome to continue this discussion at the regional meeting in Kuala Lumpur in October. And to close, a common understanding that empowering communities to take ownership of their health is crucial. Civil society organizations excel at fostering this, encouraging local engagement, and ensuring that interventions are relevant and effective. And the voices of CSOs are definitely powerful tools in steering the agenda towards the WHO NTD roadmap forward. Thank you once again, everyone, for your participation. And I hope to see you at the NNN conference this October. Thank you and have a great day or a good night. Thank you.